The title of this presentation is Spring Tests for Joint Micromotion and Stability, Part 1. And we're going to start with definitions. And definition number 1 is macromotion, which is gross movement, such as in this foot and ankle model testing dorsiflexion and plantar flexion. It's a gross movement typically measured in double digits of degrees of rotation, whereas a micromotion would be stabilizing at least one structure, such as in this example I'm stabilizing the calcaneus and I'm testing superior and inferior glide of the cuboid. This would be a micromotion. So micromotions are small movements in glide or in rotation, which are measured by the clinician only after taking up the slack in order to isolate that motion. You can think of macromotion as gross passive motion or gross active motions. So we'll move on to describe the purpose of a spring test. So a spring test is applied to a joint to evaluate micromotion and also to get a general sense of integrity of the joint. Motion can be tested within an isolated joint, such as two bones, or it can be used to evaluate motion going through linked joints, and again to evaluate stability of a joint or of linked joints. So let's take that example here. I want to evaluate motion of only the calcaneus relative to the talus, and so I compress tibia and fibula, and I can even clasp the midfoot on the medial and lateral border, and then I am only evaluating mobility of the calcaneus. There is a time and a place for this level of isolation. In normal function, the calcaneus moves with other proximal joints. And so there's another way of testing isolated movement of related joints, and that is to stabilize one structure and move all related joints. And this is measuring motion going through related structures. And so this can be thought of as a general micromotion test, and it certainly has clinical utility. And the previous test, where it's very isolated, isolates just one joint, and that certainly has clinical utility. I'm going to demonstrate using two oranges how a normal joint will behave when testing micromotion mobility. So I'm going to stack these oranges, and I'm going to take up the slack, so I'm pushing with a reasonable amount of force, and you can see that they are being compressed to an end point where no further motion is taken up. Now I could certainly stand on it and compress and break the structure, right? But that would be an excessive amount of force. You want to load it manually and load it over the course of 1 to 2 to 3 seconds till all motion is taken up. And I'm pushing with approximately 10 to 15 pounds of force. You can have a bathroom scale and practice if you like, to develop a skill of using different amounts of force. And if you have a good sense of 5 pounds and a good sense of 15 pounds, that really is a very good range to have a skill set with. Okay, so one more time. I'm taking up the slack between these two oranges, which represent two different bones in a live human. After taking up the slack, you should then be able to impart, using the same amount of force, a forward thrust and feel the recoil. And again, I'm going to go forward thrust, and then you let go, and there's a recoil. And so this is a normally functioning structure in which you can take up the slack, and you can forward thrust, and you can perceive a recoil. So that's an example of a representation of a normal functioning joint. And so what we're going to do now is take an apple. So I stack the orange, and so in this example I'm able to take up the slack through the first structure and get to an end point. But the end point is achieved a little bit earlier, of course, and it has a feel of stiffness because I'm not able, with the normative amount of force, to get through the apple. So I can take up the slack, it takes up rather quickly and feels somewhat firm, but we still rate that as normal because I can take up the slack. Now when I try and do the spring test, now there's no give, and so this is defined as a joint that has blocked mobility even though you can take up the slack. A third example will be a joint, and I don't have two apples, unfortunately, so I'm going to substitute a firm rubber ball. Okay, so in this example, the only slack I can take up is on the foam of the table, which takes up really quickly and easily. At that point, I cannot take up further slack. And we know from experience that if you can't take up the slack, you will not be able to spring and feel the forward thrust and feel the recoil. That will be absent. And so this is an example of a joint that has stuck mobility when doing spring testing early in the range such that you cannot take up the slack. So both of these scenarios are rated as blocked micromotion in the joint. And someone may have gross movement that's normal, but at the end of the joint where you test the end feel, if there's a lack of give there, that represents a joint dysfunction. The third example is certainly extreme. These are marshmallows, so they yield very readily. But this is a simple example, a little bit extreme, but if you practice with this, or even imagine what this feels like, it certainly gives you an appreciation for what a hypermobile joint will feel like. And so with a hypermobile joint, if I stack these two bags of marshmallows, you'll feel like you're going very, very far before you're actually taking up the slack. So there's a significant amount of forward excursion. And now I've taken up a slack in these structures. And now when I do the spring test, it feels like it goes really far, much further than normal, and there isn't this recoil, or if there is a recoil, it's very delayed, very slow. Do you see how slow that recoils? So this is an extreme example of hypermobility, but I think you'll find it very worthwhile, and if you can practice with this, it certainly gives you an appreciation for more subtle forms of hypermobility. So let me look at my notes and just make sure that I'm being thorough, and I'm pleased with the material that we've covered here as an introduction to micromotion spring testing of joints. Thank you very much.